Hello and welcome. My name is Raj Persaud and I'm a psychiatrist based in London. And this is a part of a series called Headstarters, where I'm talking to young psychiatrists in training, about what it's like to embark on this career. And joining me today are Amanda and Nilika, who are both young psychiatrists who have only relatively recently started on their training. And one of the things we're talking about today is how people end up choosing psychiatry, and we're particularly interested in media influences. And what prompted me to have this conversation was the fact that a lot of people seem to choose medicine or become medical students because they watch TV series like ER. They see people doing very exciting things like jumping up and down on other people's chests, and they choose medicine for that reason. But then they discover when they do the career that actually medicine is very different from how it's portrayed in ER. So Amanda and Nilika, maybe starting with you, Amanda, were you influenced by anything you saw on TV, or in fact were you very uninfluenced by media portrayals of psychiatry?
Well, I have to say that portrayals of psychiatry in the media probably wasn't the biggest influence on me, because I think at the time that I chose to go into psychiatry, there wasn't necessarily that many positive portrayals of psychiatry. But I guess those that did exist, or the portrayals that did exist, there were kind of elements that were attractive, like the idea that you don't just need to use drugs as a way of treating people, but actually that communication and speaking to people can be therapeutic in itself. So I guess there are elements, but there isn't any particular kind of TV program or anything that I would say was a huge influence or something that made it particularly attractive to me.
I was very influenced by finding a book that my parents, who are very much children of the 60s, had been reading, published by Hans Eysenck, a very famous psychologist who ended up who was a professor at the Maudsley Hospital, where I ended up doing my training and being a consultant. And the book was called Know Your Own Personality, and it gave you a series of psychometric tests that you did, and then it kind of diagnosed you. And I was very impressed by the power of this technology, where someone who had never met me, because I was living in Barbados at the time, and he was in London, could somehow know me. So I was very influenced by that. But Nilika, what about you? Anything in particular influenced you, in particular linked to the media?
I mean, to be honest, I'm a bit like Amy in the sense I can't specifically name any TV programs or movies that influenced me to go into psychiatry. However, what did influence me was knowledge that psychiatry had something to do about self-discoveration. And I realized that once you mentioned the story about the books, simply because I got a book about know your own body language and personality, the author of which I can't actually remember. But I remember thinking, well, this is quite cool, how, psychological testing and that in-depth knowledge of another person. And that certainly influenced me to going into psychiatry. But apart from that, when I think back, I think the media was very different when I was growing up and where I was growing up in Sri Lanka, where there was very little psychiatry in normal TV. The only psychiatry I had seen has been in movies, which, if you think of the time that I was growing up, was all to do with One Flew Over the Cuckoo's Nest kind of movies, which really didn't portray psychiatry in its accurate or even real sense at all. And I would say it actually negatively contributed to me going into psychiatry, in the sense it made me question a lot if I really wanted to do psychiatry. So I guess what I'm trying to say is I think the previous media, the media that was there when I was growing up, negatively influenced people going into psychiatry.
I think you're right. I think there are a lot of negative portrayals in various different ways, particularly psychiatry being portrayed as ineffective or as quite a nasty branch of medicine. So I'm interested that neither of you seem to have been influenced in a negative way by these negative portrayals. Amanda, I think you wanted to come in at that point.
Well, I was just thinking that actually, like you say, a lot of the portrayals of psychiatry, certainly at that time, were showing it as in quite a negative light, whereas actually the portrayals of medicine, it was in kind of a very positive light, where doctors treated people and they got better, and they were kind of the heroes of the situation. And I don't think that either of the portrayals are actually particularly accurate, but I do think that by portraying psychiatry in a negative way, it does influence you, and I think it probably did influence me, the idea that actually people don't respond to treatment, that sort of idea, and the idea that kind of psychiatrists are often portrayed more aligned with non-medical specialties, like interchangeably with psychologists or other types of therapists, rather than as something aligned with the medical profession that you have to be a doctor. And I think that those are things that make you question whether it is something that you want to go into. But on the other hand, I do think more recently those things are starting to change with kind of TV, well, I guess documentary type TV becoming more popular. And I think actually now there are programs out there that do reflect psychiatry slightly more accurately, which is good for psychiatry, whereas if you were presenting other specialties more accurately, perhaps it wouldn't be showing them in such a positive way.
I'm interested you should say that, because there have been several documentary style, reality TV type style kind of cameras roving the inside of the psychiatric hospital.
Yeah.
And some of these series have even won awards, but I've been nonplussed by them because I think they're really bad. I think that they tend to focus on really seriously ill people who don't seem to recover. And in one recent series, the person that they focused on, I think, ended up killing themselves. And while that obviously does happen in psychiatry, a lot of people get better. A lot of people make a complete recovery. And that doesn't appear to be of interest to TV documentary makers.
I don't know that that's true, to be honest, because a couple of years ago, or it might be more than that actually now, there was a sort of documentary type program. I don't know if you remember it. I think it was called How Mad Are You? And they had volunteers. Half of them had kind of a history of mental health problems and half didn't. And they got a psychiatrist, a psychologist, and a psychiatric nurse to try and work out who had a history of mental health problems and who didn't. And I thought that was actually quite a good way of showing that actually people do get better, and you couldn't, like, even these professionals couldn't tell who fitted into which group with any kind of ease, and often with any kind of accuracy. And I think that's more a reflection on how actually mental health services can help people, and how mental health problems do resolve, and actually stigmatizing those sorts of conditions, and say employers looking at someone's CV and thinking, oh, they've had the depression in the past, maybe would be less keen to employ them, however kind of subconsciously, that actually that's very inaccurate. And actually we should be thinking that people with mental health problems, you know, they're perfectly kind of functioning people, and it is just an episodic thing. It does get better, just like any other illness.
I mean, continuing on with what I mean, there's quite a popular program called Big Bang Theory, which I watch, and I would say is watched by a lot of young people. And that's to do with social anxieties and autistic spectrum, or Asperger's syndrome and OCD, living perfectly normal, happy, independent lives. So I think they do focus on the mild end as well, and even add a bit of humor associated with it. But I think the problem with the documentaries, maybe apart from the one that Amy mentioned, is when you focus on the most seriously ill patients, it just makes better TV. I mean, with what Raj said, if you remember the program focusing.
Oh, hello. We seem to have lost Nilika there.
Yeah.
Nilika?
Yeah. Raj?
Yeah, sorry, I lost you there for a second. Keep you saying?
Yeah, no, what I was saying is, I think when I've watched some of the more recent documentaries, especially about the inpatient unit or the 999 program, which focuses on, well, not focuses, which sometimes has psychiatry. Yes, they do focus on the more seriously unwell patients. But on the same light, there are programs like Big Bang Theory, which has people who've got, let's say, OCD or Asperger's syndrome or social anxiety, living, very normal, independent, happy lives. So I think the media at the moment does portray a very balanced view on patients or people with psychiatry diagnosis. It just depends on what program and how they do it. But unfortunately, I think the general public or even we have to look at all these different programs to get a balanced view, because one program doesn't necessarily say the difficulties and the way people live a good life as well.
Yeah, but you see, the thing is that the media isn't out there to portray a balanced view. That's not what it's about. It's about getting an audience. It's about whatever gets attention, and what gets attention often seems to me to pander to certain stereotypes. So going back to Amanda's program that she mentioned, I'm vaguely aware of that program, and having been involved in making various TV series, I'm aware that one of the terrible things that happens is the commissioning editor and the producer already knows what they want to generate before they even go and make the program. They've already set the agenda. And I suspect that quasi-experiment, they already knew the outcome they wanted, which was they wanted to show that the supposed experts couldn't tell the difference between people who were mentally healthy and people who weren't. And as a result, cast doubt on whether there really is any expertise there. I mean, Amanda may have a different view as to what the agenda was, but I think the other difficulty we have is to watch the program in the way the lay public are watching the program. We're always going to be watching it in a slightly different way, and that's the key thing. How do the lay public see it, and what interpretation are they coming to? And usually it's a negative one.
I think that's true about the dramatisation of things, because that's kind of what sells, isn't it? And so you can understand why TV kind of commissioners and the people who make TV programmes would want a very dramatic view of anything. And it's just as true on programmes like ER. They never show people turning up to ER just with a little cut, or unless it heralds some sort of disaster. They don't show all the people that should have gone to their GP. They always show the kind of dramatic stuff. But I mean, firstly, I don't know that the impression of that program that I was describing was to cast doubt on expertise. Particularly, that wasn't kind of the impression that I got. And I guess, secondly, I think with some of the programs, we do watch it in a slightly different way, and I think sometimes we can be quite critical of it as well. And sometimes there is an element that they are kind of pandering to certain stereotypes, like in the documentary about the ward. There was some comment about a girl who was having thoughts about harming a relative, and then they suggested that if she was diagnosed as having psychosis, then she would pose a risk to the person, but if not, then she wouldn't, which is, like we know, is clearly not like it's propagating the idea that psychosis would lead to violence, which isn't actually true. And so that's something that we would pick up, and perhaps those things do reinforce some of the stereotypes. But I do think, on the other hand, the they do give the opportunity for patients to kind of give their stories, and they do show a more realistic role for an inpatient psychiatrist, because actually no one's going to really want to watch a program about people who are depressed and then come in to see a psychiatrist or to see their GP and then get better the next time they come, because it just would be a bit boring.
Well, I'm not sure I agree. I think I've seen 10 patients today, and I think the drama of people's lives is endlessly fascinating. It just seems sad that the media have to go back and repeat old stereotypes. But Nilika, you wanted to come in.
I mean, I guess from whatever Amy says, I guess what I'm thinking is some media coverage about psychiatry better than no media coverage, or bad, very bad media coverage like it used to be in the 1980s or the 1990s. But going back to the topic of how does it influence us actually picking the specialty of psychiatry, my biggest concern for programs then and even programs now is the way they demedicalize the specialty to a point where I think it contributes to the stigmatization of psychiatry even within the medical specialty, even in medical school. For example, I know for a fact when I was a medical student, before I went into psychiatry, I always wondered if there was going to be enough medicine or true emergencies in psychiatry. And before I had my placements, I genuinely thought there wasn't going to be, because the way Frasier or some of the other programs had portrayed psychiatry, which was with a very heavy psychological mindset. Whereas obviously we know real psychiatry we practice is very different. And I think the media still hasn't grasped the real life of a psychiatrist. And even the TV programs like the inpatient unit that we've mentioned, I don't think really shows what it's truly like to be an inpatient psychiatrist.
Particularly in terms of the fact they are actually being doctors, is that what you mean?
Yeah, that's exactly, because, like I said, I feel like all the programs completely demedicalizes the specialty.
Amanda, did you want to come back on that point, or any other?
Yeah, no, I'd agree with that, really. I guess there's still an idea that psychiatrists see somebody who's sitting on the couch, spends out like an hour with them and sees them on a weekly basis, which is just completely unrealistic. And I guess that has implications, doesn't it, in terms of how people perceive the specialty as more aligned with kind of psychoanalytic psychotherapy rather than medicine. And I think also as a result of that, sometimes they don't go into psychiatrists as kind of people who use medication, understand quite very complex sort of pharmacokinetics of drugs, have an understanding of neurobiology and all these sorts of kind of biological psychiatry elements. And yeah, I'd agree that those sort of portrayals aren't particularly helpful in influencing whether somebody chooses to go into it or not.
Well, we're running out of time a little bit, and I'm just wondering if I can round up by posing a final question to both of you, which is that given that we're debating and arguing and we don't necessarily all agree with each other about the fact that maybe the media portrayal is distorted at the very least, if someone is thinking of choosing psychiatry as a career, maybe they're a medical student or studying A-levels or even GCSEs, and they've spotted it or been influenced by something they've seen on TV or read in a book, do you have any advice about how they could maybe clarify further in their own minds about what it's really like? Because I think they're going to have to do a bit more work than they might do in most other careers to understand what it's really like to be a psychiatrist. But I don't know what your views are on that. Yeah,
well, I mean, I agree that I think the media portrays a very dramatized and not very realistic view of psychiatry. So probably relying on those things as your main source of evidence isn't very helpful. But actually, if you wanted more information, there's plenty of information on the Royal College of Psychiatrists website that's aimed at students kind of from school age upwards, really, to inform people about what it is like to be a psychiatrist. And I guess as when you're at medical school, you can do your placements, and even before medical school, you might be able to speak to psychiatrists and find out more about what the day-to-day life is. And I think that would be way more accurate depiction than relying on Frasier or some of the docudramas that are available.
Yeah, I would agree with Amy. At least try and speak to a psychiatrist. And I know most psychiatrists are more than happy or willing to speak to even high school or college students who can contact them. Just pick the phone up and contact reception. Even for me, the biggest advantage was doing a placement. That really did open my eyes, because I was one of those people who was questioning, should I do psychiatry or not? And how I made my mind up was by doing a placement in psychiatry during my foundation years. So that's what I would say. I think the best way to find out what it really is about is to do a placement, and then make your mind up.
Amanda and Nilika, thank you both very much indeed.
Thanks very much.
Okay. Bye.